Hi, Regina.
Hi, Marie. It's so good to get to hear you talk about all the great work you do.
Ooh, I love you being here.
I think I want to give just a couple more minutes or just a little bit more time for people to roll in or get connected to. But thank you everyone for hopping on. Go ahead. Let's go ahead and start. So good day, everybody, and a warm welcome to each of you. And I'm sure we'll have a few of you joining a few minutes here in a little bit. Thank you for joining the Vanderbilt University School of Nursing Global Collaborative Series. This is a platform dedicated to exploring the diverse landscape that we have of advanced nursing care around the world. And my name is Shelza Rivas, and I am the Director for Global Partnerships here at Vanderbilt, and I will be moderating today's session. If I could take a moment to now thank Megan Allen, who is DNP leadership student, and all of our colleagues and coworkers who have worked very hard to develop and implement this program. And the purpose of this series goes beyond borders. So it is a journey to learn, to understand, and to foster connections that may lead to meaningful collaborations in the realms of advanced practice nursing, education, and even regulatory frameworks. And it also serves as an open invitation to communicate, to share experiences, and to collectively contribute to the enhancement of advanced nursing care on the global scale, which is very cool. And just as a reminder, and Marie, you may proceed to the next slide if you wish. This is a continuing education opportunity. So Vanderbilt University School of Nursing is accredited as a provider of nursing continuation professional development by the American Nurses Credentialing Centers Commission on Accreditation. So this activity will award one CNE to all who successfully complete the learning activity and submit the required program evaluation. And so as we embark on this journey together, we'll be using our familiar Zoom format for today's session. And so I kindly request that you keep your microphones on mute during the initial portion of the presentation so that we have a smooth experience for everyone. And rest assured that there will be opportunity to engage with questions and comments once our presentation concludes. And this slide is just to let you know that we have two more sessions coming up in August 21st and September 18th. We'd love to have you attend with these amazing advanced practice nurses who will be talking about their respective fields. And now, without further ado, let me introduce our esteemed presenter for today, who is an expert in the field of global health and who will guide us through valuable insights and perspectives. So we have Dr. Marie Martin, who serves as the Associate Director for Education and Training at the Vanderbilt Institute for Global Health, which we know as VIGH, and is an Associate Professor in the Department of Health Policy in the Vanderbilt School of Medicine. So at VIGH, she is responsible for the curricular and academic program development in global health at Vanderbilt and abroad. Dr. Martin teaches multiple courses in global health across the university. She also oversees the graduate certificate in global health, which a few of our faculty might be familiar with, chairs the Vanderbilt University Medical Center's Global Health Education Committee, and she also co-directs the Global Health Track for the Vanderbilt MPH program. She's dedicated to building local and regional capacity for future practitioners and leaders in the field, and she works with universities in multiple countries to really build that robust training and educational programs. Her current grant-funded work in Liberia and Zambia is focused on faculty development, mentorship, and health science education strengthening. Dr. Martin was inducted in the VUSM Academy of Excellence in Education in 2017, and recently she was a recipient of the 2021 Consortium of Universities in Global Health, Belgique Global Health Award for Teaching Excellence, as well as the Margaret Cunningham Women's Center Mentorship Award in 2022. So please join me in welcoming global expert, Dr. Marie Martin. So happy to have you today.
Thank you, Shelza. And that was a very gracious introduction, and saves me from having to say some of those things. But it is really, really nice to be with you. It is a small group today. Hopefully, more will come, but it also enables us to have potentially more robust conversation. So I'll welcome any of y'all to unmute, to post a question in the chat so that we can make this, interactive and really meet your, various goals for the session. So as Shelza mentioned, I am at the Institute for Global Health, and today what I thought I'd do, which differs a bit from some of these past sessions, is that I'll highlight some of the examples of how VIGH has collaborated in the past and currently with the School of Nursing, and then highlight a particular example of nursing and educational initiative that we have ongoing in Liberia, to train not only nurses, but other cadres of health workers, all of whom serve as clinicians, but also academics, researchers, and policymakers. And then have some time to brainstorm the ways that you might partner with us. If you'll allow me, I have a quick video that I think captures the particular approach that we utilize at VIGH in terms of our capacity building activities.
Imagine a health worker.
It's simple, isn't it?
Isn't it?
Let's imagine she's...
Or she's...
Imagine she's a he.
Let's stick with a her. What about we call her Flo?
Florence.
Flo.
The thing is, whatever a health worker looks like, whatever she's called, imagine this. She saves lives every single day.
She's amazing.
But like many of us, she dreams of more.
Imagine that dream takes her to the big city.
You don't have to imagine that. This is what happens, time and time again. She might get a job at a private clinic. Or maybe she moves abroad to chase her dream.
Look, here she is in London.
She's working in a hospital.
Now imagine what's happened to us.
The people she left behind.
My wife died when she gave birth with no health worker to help her. Nobody in our village gets vaccinated.
Our children are dying from pneumonia and diarrhea.
We don't know how to protect ourselves from HIV and malaria. It would only take one health worker to show us. There are 2,000 people in our community, yet we don't have a single health worker.
Where is
the health worker?
Where
is she?
It's hard to imagine 1 billion people.
It's harder still to imagine 1 billion people without a health worker.
Okay, cheer up. Imagine this.
Imagine she stays. What would it take to make her stay?
Imagine investing in her. Imagine paying her a living wage.
Imagine giving her quality training that she can pass on. And imagine giving her the proper tools for the job.
Now she's got support.
She feels safe. She's also got the respect of the people around her.
We listen to her and we learn.
She is important to us and we value her.
Imagine what would happen then.
Over the years, she could save hundreds of lives.
She could inspire and train hundreds of others to become health workers like her.
I could be one of them.
So could I.
Each of us could be saving lives in our own communities.
Imagine that.
And then imagine what happens next. And then?
And then, a health worker for everyone, everywhere. Imagine that.
Now help us make it happen.
Well, I think that sets the stage for the Vanderbilt Institute for Global Health, and hopefully will be as inspiring for you as it is for me and those who work here. So for those of you who are not familiar with the Vanderbilt Institute for Global Health, we are an interdisciplinary institute that serves all 10 schools and colleges at Vanderbilt and also the medical center. We're really focused on improving the health and well-being of foreign nationals here in the US and also in global settings. And we do that really in a similar way as the university, with 3 pillars of education and training, research, and service. And we do that all over the world. This is a snapshot of some of our core faculty's projects. You may see some familiar faces from the School of Nursing, including Carol Etherington and Kate Klaus. We have many other members, around 70 from across the institution and beyond, who provide interdisciplinary support, have collaborations and networks globally. We're always looking to expand those numbers and grow that network. But you'll see that it is quite an interdisciplinary group of faculty, recognizing that the issues in global health are somewhat intractable, and bringing together interdisciplinary teams can potentially move the needle. So as a disclaimer, I'm not a nurse, but I've always dreamed of being a nurse. So maybe that'll be a future aspiration. I sit at this intersection of education, policy, and health. And my training is in public administration, international education, and I direct our education and training activities here at the Institute and beyond. And some of the strengths and I would say values of the Institute, which are reflected in our education and training programs, include a shared interest in global impact, particularly thinking about training the next generation of leaders in a variety of spaces. Sustainability, in essence, building off grants and collaboration to work ourselves out of a job. Focus, so we have a number of focus countries where we do our work and where we've been collaborating for many years, if not decades, with a real goal towards mutual benefit and cross-cultural learning. I often talk about our work as capacity building or capacity strengthening. And so I think it necessitates to a certain degree some definitions around what capacity building means for me and for us at the Institute. So we really think about it across a period of time with some increasing levels of complexity, starting at the individual level, whether that's here at Vanderbilt with School of Nursing students or public health students or medical students, or abroad with those similar kinds of students in other academic institutions, and helping to facilitate the development of durable competencies, skills to really enact change in the clinical setting, in the research setting, in the policy setting. At the organizational level, to work with organizations, ministries of health, and others to improve structures and systems to really keep these changes and improvements in place at an organizational level. And then lastly, at a societal level, enabling effective policy development to ensure high quality care and also health sciences education. So when we think about that at Vanderbilt, I will just briefly touch on this before I spread out and go global. But we work here. The Institute was founded in 2006. we've worked over that time with lots of students in a number of different capacity, whether that's one-on-one mentoring, teaching through a number of global health courses that we've developed, placing and mentoring and guiding students in field experiences abroad or in clinical rotations, working on students through a very large global health case competition that we run every year. We're planning right now for our 12th iteration of that, and through student publications, really working to disseminate findings in high impact journals. At the School of Nursing, we've really enjoyed a rich and productive academic collaboration. So as Shelza mentioned, we've had a number of School of Nursing students complete the graduate certificate in global health. We've had 17 since 2010 when it was established. And then we either partner, support, provide guest lectures, are a sounding board for other relevant courses at the School of Nursing. This provides a unique opportunity for your students in particular at the Vanderbilt School of Nursing to build their skills, their interests, their networks in global health. And we usually have more students than are able to participate because of their tight schedules, but we have opportunities even beyond training for those students and graduates to engage in global health. So we run the Frisk Global Health Leaders Program that's supported by Hope Through Healing Hands, Senator Bill Frist's global health organization. And since 2010 have been able to support 12 nursing graduates from Vanderbilt to engage in service and training experiences in underserved communities around the world. So these students have connected with clinics or hospitals in low resource settings to really leverage their training and expertise with the needs on the ground. And we have more information on all these programs, but at least wanted to give you a snapshot of the ways that VIGH engages right now with the School of Nursing. One thing to highlight is that you have your own transformational global alumni, and I'm showcasing two right here of whom some of you may be familiar with. These are two Kenyan DMP graduates who were supported by Dean Norman in particular, and have quite literally written the book on advanced practice nursing in their country. So Dr. Kiari and Dr. Muchendu each play a unique role in the advanced practice ecosystem in Kenya, serving as heads of academic programs, facilitating curriculum reviews, creating and proposing policies, and really guiding the next generation of advanced practice nurses in their country. So really amazing to already see the scope and impact of your programs globally. That scope and impact has also been seen through symposia like the Nursing Leadership in Global Health Conference that happened 10 years ago, led by Carol Etherington. We're talking now about part two, if you will, to really continue to address and elevate the voice of nursing leadership in the world. For that particular conference, there were just some really fantastic, well-known leaders in nursing globally who attended, 14 countries represented, around 230 individuals that each made some pledges to advance nursing in their settings and recognize that nursing is a key component for scaling global programs, and that nurses have an opportunity to take advantage of opportunities to fill gaps, particularly in fragmented health systems. So I'll pause there before jumping into some present nursing and educational initiatives in Liberia to see if there are any questions about the work and collaboration at the School of Nursing, recognizing we'll also have time at the end to talk about it. So this is not your only time. All right, well, I hope that you're able to generate some additional questions for later because it's exciting to imagine the ways that we can build off some of the work that we've done in the past. So I'm shifting gears here to spotlight an example of some ways that we support nursing and educational initiatives abroad. So I work in particular in Liberia. This is a place that I've been working for around 8 years. Many of you all are familiar with Liberia, without a doubt. It has a unique history in that it was established as the first African republic by repatriated freed slaves. And so that means the connection between Liberia and the US is quite strong. And it has a number of exciting, promising, really fantastic collaborators there that make the future bright, I think. Currently, Liberia ranks 178 out of 191 countries on the Human Development Index. And that's in large part because a number of crises that have impacted Liberia recently. A number of civil crises that resulted in around 90% of the healthcare workers leaving the country and stymieing the progress of other health workers during that time. We're, I think, painfully aware of the Ebola crisis that occurred between 2014 2016 that further exacerbated the health workforce crisis, with about 8% of those remaining losing their lives. And then while COVID-19 was not as devastating, it still was very difficult for a weak health system. So currently there are less than 300 physicians for a population of 4.5 million. And both the doctor-patient ratio and the nurse-patient ratio fall significantly below the WHO recommended guidelines. Even most of the midwives and nurses actually work in urban areas, and so that compounds the situation, particularly for rural women. Because of the limited health workers, nurses play a very key role in the Liberian health system. I would say that's not unique to Liberia. Globally, we see that with nurses really being the central guiding force for many health systems, but it is just heightened in a setting like Liberia. When we look at health workforce projections, it's bleak unless there are sustained and sizable investments to kind of close the gap in terms of needs and current workforce. The former Minister of Health, who I partner with very closely, Bernice Dawn, established 2 plans for building a resilient health system and a health workforce. And these guidelines actually initiated the first ever revision of midwifery and nursing training in the country. So curricular revision that was really nested in this as a response to these crises. So that leads us to some current grant-funded work that I think can showcase some of the investments and progress that's been made in Liberia. Vanderbilt Institute for Global Health has partnered with Bernice Dawn at the University of Liberia. She's in the center of this picture, along with Yale University on a 5-year, $15 million USAID award. And this award is principally meant to create a public-private academic hub for training throughout the health sector. So this is, all cadres of health providers, strengthening research, strengthening health innovation. And so thinking about the multiple parts of the health system that need reinforcement. We have a number of different activities. I won't belabor them here, but I will just showcase some of those. One is the Center of Excellence for Teaching, Learning, and Innovation, under which a number of different programs fall across the pipeline. And then building infrastructure and support at the university to manage finances, grants, and create systems for continuing education for clinicians. I'll just highlight that 3 of these are led by nurses, and really we couldn't do this work without their vision and guidance. And so I can showcase lots of things about those individuals or answer questions at the end, but in the interest of time, I'll at least go into some of the programmatic activities and nursing education in particular. These 3 areas, though, I'll talk a bit about continuing education. I won't talk as much about our simulation center, but when we think about collaboration, this grant has enabled us to set up the first high fidelity simulation center in the country, the only one, and one of the few in West Africa. We have a sim mom, sim baby, sim man, a very state-of-the-art simulation center at the teaching hospital that can serve well for bilateral exchange and teaching, depending on what the needs are. We also have just instituted a certificate in evidence-based health policy. I'll be leaving for Liberia on Sunday to graduate our first cohort of policymakers at the Ministry of Health who have been involved in a 9-month program to integrate evidence, high-quality evidence into health policy. So all of this work is based at the University of Liberia College of Health Sciences. And so I wanted to show you kind of an organizational chart so that you understand the programs that are offered in the university and the future goals related to midwifery and nursing as well. So you'll see that currently there is a new school of midwifery, and that meets a particular gap in the country. Liberia struggles with one of the highest rates of maternal mortality globally. And this was a intentional focus on midwifery to improve the quality of services for that demographic. University of Liberia also houses the only school of medicine in the country that graduates around 50 students a year. There's a school of pharmacy and a school of public health with plans for additional schools of dentistry, biomedical and allied health sciences, and an expanded nursing program in the future. So strengthening the nursing education pipeline is not just at the university, as we all know well. It actually starts in secondary school and it reaches through to the health system. And so while formal education in nursing and midwifery began around 1922, there are very few nursing program, bachelor level nursing programs. About 90% of nurses have the equivalent of an associate's degree, and there are currently no master's level training or doctoral level training. So as part of the plan to strengthen this pipeline, I'll focus on 3 particular initiatives that focus on nurses and other cadres of health workers, just to give you a sense of how we engage. I'll start with the secondary school. It's potentially the most fun. So this is a high school science camp that we've run since 2021, recognizing that students entering into the university really struggled in the sciences. And most of that was because there were limitations in science and STEM more broadly training in secondary or high schools. So we supported the development of a high school camp, a 1-month program, very intensive for students across the country that have a proclivity for science. So these are our future nurses, our future doctors, our future public health practitioners. And the expectation is that they matriculate into the College of Health Sciences after completing the science camp and are just set up for success. So we're trying to reach a younger audience. So we use TikTok and YouTube. And this is just an example with some images from our camp last year that might give you a sense of what this camp looks like in practice. We have a very specific focus towards gender equity and also inclusion of rural populations that otherwise are really disadvantaged in this space.
And it went like.
So that camp will actually expand to 2 locations this year. And on Sunday, I will go to both. So I'm very excited for the next iteration and the expansion of this camp in the country. So I mentioned that was at the secondary school level, so farther up the pipeline. But when we look at the University of Liberia, NYU School of Nursing in particular has been very supportive and provided really critical mentorship and guidance for the nurses at the University of Liberia. But there are lots of other opportunities to partner as the academic programs are strengthened and developed. So as I mentioned, less than 0.5% of nurses and midwives hold master's degrees in the country. And those are nurses that receive their training outside the country. ULCHS received full accreditation to offer a bachelor's in midwifery last year. So we've just matriculated the first group of students. A 4-year bachelor's program in nursing is currently in development with plans for master's and doctoral level training at the institution. So lots of opportunities for growth there. When we think about where those graduates go after leaving university, they go into the health settings that has until now not had a very mature continuing professional development system with policies, regulations, enforcement of standards. So our grant has brought together the 6 health professions boards in the country over the past 3 years to establish policies, curricula for evidence-based CPD in the country. And the standards for each cadre of health workers will be fully instituted in 2025. This is a pretty remarkable achievement led by a nurse, I will say, and couldn't have been done without her. But it represents essentially a new milestone for the country in terms of enacting these kinds of guidelines. it's one thing to develop them. It's another thing to educate clinicians about the requirements and new regulations. So like TikTok, we've employed a number of different ways to reach our audiences. One of those is through radio and also through TikTok and YouTube, but creating music and creating infomercials that can raise awareness around these new requirements for different health professions. So I will let you enjoy one of our songs, which apologies, it may get stuck in your head. It is very, yes, it has a tendency to do that, but I think you'll see how fun and exciting it is to really utilize these different platforms to educate.
CPD, continual professional development. In a world of hell, my knowledge can take flight, so CPD, a beacon shining bright, so from April 2025, the bend is so clear, oh. For your lessons renewal, you lend me your ear. CPD, got the key to professional elevation. Positions, lessons, and every definition. AUIs, EAs, pharmacists, unit, environmental health in the lending life. Like conditions, now a habit of care. CBT, now I answer my people, be aware.
So across the pipeline, we have invested in and partnered with some pretty remarkable people to start at the secondary level through university graduate training to those who are actually directly engaged in clinical care, policy making, developing new innovations, entrepreneurs, and faculty at the university to equip them all with the skills and competencies to enact improvements in health outcomes and really drive inclusive economic growth in the country. So that's a bit about Liberia, and I will put up just one remaining slide to brainstorm future collaboration, and I welcome any and all questions from you. But I often, when I give presentations, get asked, well, how do I engage in my unique space? And so I have a number of different ways that we could brainstorm, and you could think about collaboration as we kind of sit in these virtual spaces. I am always open to Zoom calls or meetings in person. But if you think about this, depending on where you sit, if you're a student, for example, imagining pursuing research or clinical electives abroad, even service activities through the Frisk Global Health Leaders Program and others. If you're a faculty member, considering collaborative research, even faculty exchanges bidirectionally. Imagining how you might engage if you're a faculty member, staff, curriculum designer on some of these new academic programs like nursing, you know, in terms of master's, bachelor level training, and even at the doctoral level. And then there's always a possibility for remote teaching, remote mentorship of students in research. So not everyone has the benefit to travel. There might be things that hinder that for each of you, but there are ways in all of these different domains that we as a community can engage in this work. I use Liberia as an index case, but there are many other places that we work globally. If you'll remember the initial slide that I showed you that showcases faculty faculty across the globe. We have a large number of activities in sub-Saharan Africa, but also in Latin America, where I know you all have faculty projects as well. So it's nice to imagine how those partnerships can be leveraged and synergized to really enhance and advance nursing in particular globally. So with that, I think I will pause and open up the floor for any questions, comments, contributions, anything at all.
I think I'll jump in real quick. I wanted to tell you that was fantastic. It's really fun to see it kind of from a non-nursing lens, but then you kind of wove us in there. My question was back about the high school program. How was that created? Was there like a model from the US that you took, or where did that come from, that idea?
Yeah, so it's a great question. We actually brought together a number of different individuals from institutions, from Yale, Vanderbilt. We had some student interns who were pre-med or in medical school. And then we had, importantly, Liberian basic science faculty who taught in particular kind of at the preclinical level, and medical students at like later stages, or nursing students at later stages of their training. What that enabled us to do was to collectively build out a curriculum that was inquiry based, that was contextually appropriate for Liberia, that was driven by some of the gaps that had been identified in the College of Health Sciences training programs. So in particular, lab sciences, there were, students that had never seen a microscope before, right? So we're addressing some of those things. I see I'm frozen, but hopefully you can still hear me.
Yeah, we can.
Okay, perfect. And so it was really driven by some of the gaps in the training programs that were in existence, some of the gaps that had been identified at the secondary school level. Historic fields have been taught by Peace Corps workers who were there for short periods of time. And during COVID, Peace Corps closed its doors. So we knew that that was already a deficit that needed to be addressed in the curriculum. And so those were some of the ways that it was built out. I have to say that the students on the ground and the faculty were so innovative in creating not just curriculum, but also the wraparound extracurricular activities like debates and role play and bingo night for health sciences education, these kinds of things. So really exciting, and a lot of nice networks and mentorship opportunities that emerged on a peer level. So that might have been a longer version of the explanation.
But it's such a great idea. And we could obviously use that here in the United States just to fill the gaps we're experiencing, obviously. You mentioned that the kids who complete that program are expected to go into these health educations services. Is that sponsored by their government, or how do the kids pay for that?
Great question. So in Liberia, university education is free.
Okay.
And so that was instituted by the last president of Liberia. So all university education is free. They have to pay stipends, but they're typically quite low, and they also get money from the government to support some of their studies. So ostensibly finances don't stand in the way, but if you are in a rural setting where you have to travel to the capital city for training, where you have to pay for some accommodation, where you have to buy books or data, then there are obstacles. There are endowments that we're setting up at the University of Liberia. That's not a traditional mechanism for raising money, but there's a broad diaspora for Liberia, and also, you know, opportunities for individuals like us who may be compelled by the country's story to contribute to endowments that would support scholarships for students in the future.
Very cool. Thank you.
I will add, Megan, thank you so much for your question. We actually have a secondary school that just opened in Nashville, Nurses Middle College, it's a nursing high school. And they're holding their camp as we speak. And their intention is to funnel graduates from this high school into BSN or fast track programs locally in Nashville. We have the originating founder, CEO is from Rhode Island. And so she brought her program here, and I'm curious to see if there could be a really cool partnership between our scholars here who are going through the same process with the students in Liberia, so they can see that it's not just them, it's you know, happening in different countries. And of course TikTok, why not make it like a TikTok video? Who knows? But it is happening here in Nashville, and they just started the matriculation this fall for their students, so it's very exciting.
That is really
Yes. Bongi, I saw your hand. Do you have a question?
Yes, firstly, thank you, Dr. Martin, for such an insightful and informative presentation. I'm based in the UK, so just to follow on what has been being discussed around widening, we call it widening participation in the NHS. So it's sort of our routine really from an education leadership perspective that we get all professions to reach out to high schools, and we bring them for work-based observations around 16 to 18 years of age, so they can decide which area of healthcare professional they would want to do. And from an organizational NHS perspective, they also actually get funded. They can be employed and work as apprentices and get funded throughout the university. So it's really great to see that's happening in Liberia. I'm originally from Zimbabwe, so I'm fascinated, and I do a lot of work in Africa. It was good to see some examples, especially from Kenya, where I'll be in 2 weeks' time. Nairobi. So Kijabi, I've worked with their colleagues from Kijabi as well, and some of the DNP graduates as well from the US organizations. I'll be certainly keen to explore some collaborations, especially around the work we're doing in Sub-Saharan Africa. One of the things I'm doing at the moment, or that I've just finished doing, and I'm moving to the next stage for sustainability, is implementing the Sigma Global Nursing Leadership framework. I'm not sure if everyone is aware of it, but I can put it in the chart. And basically what I did some seminars and evaluated that, and Vanderbilt was part of that with Dr. April Kapu contributing as well. But what we found was that we could actually apply that within a multi-professional context, which is mainly my work. My work is around all multi-professional health professions education. And I'll be really keen to follow this up and explore. And obviously, if any of you are going to be closer in Liberia, if you are able to snip and go to Nairobi, it will be good to see some of you in Nairobi as well. Thank you.
Thank you, Bongi. That's amazing. What is and this is just a curious, Nairobi and Liberia, do you know how far away they are?
Well, Liberia is in the west, and
okay.
and Nairobi is in east.
Gotcha. Okay. Just curious. Thank you so much for that awesome comment and collaborating.
Oh, I asked the same question last time I was in Liberia. It's about 7 hours, they said, because I took Kenyan Airlines from Accra to Monrovia. So I was just curious myself. So it's about a 7-hour flight.
7-hour flight. Great.
Thanks so much. Sorry, I'm at Vanderbilt, but my Wi-Fi has gone down. So
we can hear you still.
Okay, wonderful.
Yeah, we can hear you still. Does anybody have any other questions? Oh, Juliet.
It is wonderful to hear you speak. Thank you so much for coming. I am super interested in midwifery education abroad, so I'm happy to connect with you via email. I'm sending off my final child to college, so I feel like I have a little bit more space. And I would really love to see the pipeline of midwives expanded.
Wonderful, wonderful.
And Julia, you just had your grant, your Meadow grant to help with community health workers, I believe. No,
It's for midwifery students. So the midwifery students that receive this grant, and I also have slow internet at the school.
Oh,
Um, the students that are interested in serving in rural and underserved areas can apply for this grant. We have 10 trainees a year, and they get around $56,000 in stipends and some additional curricular enhancements. Even the U.S. really struggles to retain their brain power in rural and underserved areas.
wonderful. Well, Julia, I'll send you a message right now. I know that we had touched base before, but this
I think right ahead of the pandemic.
Yes, so this is an opportune time, sending your fledglings off and bringing in some new mentees.
Perfect.
Hey, Dr. Martin, it's Megan again. Being an outsider, a non-Vanderbilt alumni or faculty or student, I'm wondering those opportunities you mentioned, the FRISC, Global Health, those kinds of things, are those mostly unique to Vanderbilt students, or where do you see like an outside student like myself or an outside clinician trying to get into this world?
Yeah.
How do we find these opportunities?
That's a great question, Megan, and I'm glad you brought it up. The FRISC Global Health Leaders Program is unique to Vanderbilt and a few other institutions. So it's not open more broadly, but there are other scholarship programs for short-term and longer-term individuals depending on their interests. So there is Fogarty, Fulbright that supports clinician researchers, for a year abroad. So that might be longer than an individual would want to spend, but I would recommend Googling, looking at your nursing societies, even your specialties, to see are there smaller travel or pilot grants. Also checking, for example, at Yale, they have, an Institute for Global Health where they spearhead different kinds of training opportunities and scholarships. So I'd also look at your institution. And then reach out to nurses or other individuals that work in global health. It's amazing how open the field is to collaboration, mentorship, and opening up doors for opportunity. And there's so many different ways to engage, right? So look at England, and the NHS has pre-employment education aligning. Oh, well, maybe that's a different one, but I will look at that article too. But even if you are, it leads me to essentially the next point is even country governments, NGOs within countries can have a focus on advancing the nursing field in global health. And so you could look there as well.
Great, thank you.
Yeah, but it's a great question, because thinking about how to engage, how to build it in if you're a faculty member or a staff member, how to build that in intentionally into your work is not always easy to do. So learning from those who have been able to do it in different ways can at least create some models and allow you to crowdsource information that's appropriate for wherever you are in your career trajectory.
Great, thank you.
Hey, Marie, I know it's Philip. I know you've talked a lot about education. Can you talk a little bit about research capacity and the roadmap?
Yeah, so in terms of research at the College of Health Sciences, we have been focused on really enhancing the ecosystem there so that independent research can happen, right? So that faculty members can submit grants, be supported by the institution to manage those grants, and really continue to build a robust research, sector. So that requires obviously individuals to have research training, and you've been instrumental, Philip, in partnering with us to build skills in searching the literature, assessing the literature, and creating opportunities for independent researchers to collaborate with globally, right? So is there someone who has shared interests as you do, Philip, that you all can come together and collaborate on a research project that could be supported by the systems at the university? And I would say it is young, but rapidly growing. And there is that expectation that the university will launch the country's first PhD program next year that will leverage foreign partners to provide additional mentorship and teaching, but is really based at the university and driven by the goals and the needs of the country. So that will open up additional opportunities for faculty, for example, or staff who have a research interest to potentially partner with students or with other faculty at the university. And I think the opportunities really will be numerous moving forward. And I owe you an email, Philip.
All right, thanks.
Hey, my name's Barbara. I have a question. I'm a Vanderbilt alumni years ago, but I'm not in the Vanderbilt employment system right now. I haven't been for many years, but I'm a nurse practitioner, and it's very interesting to hear this discussion and what's going on. I mean, it's exciting. I just wondered, are there opportunities? You talked about mentors that are, in place or even virtually. Are there opportunities for people, like me, that are totally outside the system to do that? Or is it something that you have to be involved with the global health, your global health collaborative? So I'm just curious. I'd be very interested. I've done a lot of international health work, but
wonderful. No, I think that in particular, mentorship is low-hanging fruit, right? And when I'm in Liberia next week, I can certainly talk to the head of the midwifery program, who obviously, is part of the larger development team for direct entry of nurses into the university and other health providers. And I think mentorship for those nurses would be incredibly valuable. We know that mentorship, just in the literature has many benefits that accrue in terms of self-efficacy, in terms of progression in their career, in terms of even retention in academic programs or in the nursing profession. So if you wanted to reach out to me, Barbara, maybe in 2 weeks or so, then I could imagine an opportunity to link you with an individual or a group of nursing students or nurses that you could think about how to potentially build informal mentoring opportunities. I think that would be fantastic.
Okay, great. Yeah, I mean, I mentor so many students here in the United States. Actually, I just mentoring a student this summer that is actually coming to the Vanderbilt nurse practitioner program. She found me on LinkedIn. So anyway, we've been
perfect.
meeting and just, that collaborative kind of, or just mentorship role type deal.
Great. So. Well, I love that. And it's, potentially a call to action for us to think about multiple ways that faculty and those outside of the academic enterprise can engage in a place like Liberia. So thank you.
Well, if we don't have any other questions, then we can go ahead and wrap up. We got about a minute left before we're at the top of the hour, but I want to thank everyone so much and thank Dr. Marie Martin for giving us such amazing content and presentation and information to really ponder on and really, I I think the opportunities are very abundant, to the point that it's a little overwhelming, at least personally for me, but it's exciting. So I got to kind of simmer on the information and kind of make a couple points. I know I'm meeting with you soon, Marie, and so we'll have a lot to talk about. But if you're able to complete the feedback evaluation form via RedCap today, after we finish our session, you will get CE credit for this session, and we'll love your feedback. And then our next session will be August 21st with Dr. Selena Giles, who will be speaking with us about advanced practice nursing in Nigeria. So would love to see you all attend, and please have a wonderful, wonderful rest of your afternoon. Thank you so much. Thank you,
And
Marie.
thank you all. Thank you.
Thank you.
Great being with you.